So does 9 a.m. Tomorrow work for you? Okay, cool. Okay, so does 9 a.m. tomorrow work for you? Okay.
Is actually a family of viruses. They cause things from the common cold up to more serious conditions. What we're looking at and talking about right now, though, is the 2019 novel coronavirus. That's a new type of coronavirus, first identified in China in December 2019. Currently, the European Centers for Disease Control rates the threat to the population here in Europe as low. We're learning more and more about this virus every day. Currently, the United States Center for Disease Control believes that it is transmitted from person to person through respiratory droplets, the same way the flu is transmitted. This typically requires you to be in close contact, or within about 6 feet of somebody who's infected. It can also be picked up from surfaces, because the way it's spread is when somebody coughs or sneezes, their respiratory droplets travel through the air and can settle on the surface. But the symptoms seem to be consistent with a flu-like illness: fever, headache, cough, sore throat, runny nose, and just generally feeling cruddy. More severe more serious conditions. What we're looking at and talking about right now, though, is the 2019 novel coronavirus. That's a new type of coronavirus.
Yeah, so it's already going to show it.
Hi, Christina. Nice to meet you.
Nice to meet you.
So I don't know if you guys want me to share slides, if you want me to show that kind of versatility, or if you want me to just keep talking with her. So I have a presentation that I typically do, Christina, to train providers on the actual system. So what I'll do is I'll just kind of throw this up and share my screen with you, so you can see that.
Okay, perfect.
And I'll just make sure that I have it here. We'll just kind of go forward from there. So you're on my screen 2. I'm going to show you what screen 1 looks like. This is the slides that I shared. Can you see those now?
Yes.
Okay. So typically what I do is I just walk providers through this wonderful training and kind of show, and I can bring this, so those slides will kind of rotate forward and you'll just kind of moving through.
Okay.
The virtual medicine in Europe. The other thing I do with this computer system and this virtual communication is work with my research subjects. I may show them talk to them about our research trial and kind of how things are going. So I have some fun graphs that I can show you.
Okay.
Let me just pull that up for you so you can see what that looks like. If I get that one that has all the fun codes for you. Okay, so I'm going to share my slides with you on this. So this is the tool that we use. It looks like a little mouse. And our service members take various different tests using the computer. And when they do that, this is the result that I get from a kind of a plot. It shows, how they're doing in comparison to a controlled population. So you can see so I work in the TBI clinic. So what I'm looking at is how they're recovering over time. So you see day 1, day 5, or day 14 as what I did at my end is I troubleshot for us for the B-roll so that you would see how to check the system by testing my microphone and testing my speakers. I think you might have had your speakers accidentally muted for a purpose. So those are the kinds of steps that I go through with our patients oftentimes, but what you just pointed out is the value of having a telephone to fall back on. So I could have been able to walk you through those problems as we were on the video chat communicating. So I'm going to go ahead. Given the heads up on how to do this, you can ask for your appointment to be done by virtual health.
I actually have the number for them so I can reach out and see if they're able to set this up.
Perfect. Do you think more patients would use this platform if they knew about it?
I think so, because I know a lot of people are, I'm in like some of the Facebook groups, and I know some people are concerned about like minor health issues, but there's still issues that they need to get, seen for and taken care of. So I'm sure they'd love that opportunity.
Yeah, I think the nurse advice line is a great way to get some of those questions answered, but nothing, for me personally, nothing beats face-to-face, at this point in time. So what I'm going to do, Christina, now is I'm going to talk to Dr. Kornfeld and our medical director for virtual health and say, hey, you know what? Patients, they want to be able to have the opportunity to talk to their provider. Let's talk to the patients and have the patients start to advocate for this kind of interaction. So when they do come in, you may have to be talking to them like this face to face, or you can do it